This is Sadie. Sadie is only 3 years old, and she doesn't know it, but she's about to lose her best friend forever. Sadie's mum, Maria, was diagnosed with diabetes at 32 years of age, and after years of struggling with kidney and eye complications, sadly Maria died at 39 years old from an entirely preventable and reversible condition, type 2 diabetes. Maria's two daughters will now grow up without a mum because Maria was never given the tools to treat her health condition. And there are 460 million people globally with type 2 diabetes just like Maria. This is the type 2 diabetes growth curve over the last 40 years. Around 26 million people have diabetes in the USA alone. And all other chronic conditions such as obesity, high blood pressure and cholesterol have followed a similar trajectory. And globally 1.5 billion people suffer from a chronic health condition. And almost all of these people are being treated with medications, but the death toll just continues to soar. And why? Well, because medication alone does not cure chronic disease. The current paradigm is not true healthcare. In fact, it is sickness management. Can you imagine a headline like this? Patients suffering from the complications of peanut consumption are currently managing their symptoms by injecting themselves with an EpiPen every time they eat peanuts. Now that headline is not real, it's obviously fake news, as you would never eat peanuts and take an EpiPen knowing that you're allergic to peanuts and you're going to have a reaction like that. And while this headline seems far-fetched, the equivalent is unfortunately currently happening in the chronic disease space. You see, simply put, type 2 diabetes is essentially carbohydrate intolerance. A bowl of cereal, for example, is equivalent to 21 spoons of sugar when it boils down in the blood of a diabetic patient. Let that sink in for a second. 21 spoons of sugar in the blood of a diabetic patient. And having these patients eating refined carbohydrates and taking medications like insulin to lower their blood sugars is like having someone with a peanut allergy eat peanuts and then use an EpiPen to offset the reaction. Using medication to treat type 2 diabetes does not address the root cause of the condition. You see, the root cause of these conditions are lifestyle related. Patients are suffering needlessly and doctors are overwhelmed. Most doctors see upwards of 250 patients per week, and they have an average of 7 or 8 minutes per consult. And in most cases, this results to a referral, such as a specialist like a dermatologist or an oncologist. And as general physicians, doctors have to know a bit about everything from a runny nose to a rare cancer, and they often need to refer to a specialist. Lifestyle therapy should be no different. Patients should be referred to an evidence-based therapy program. However, most doctors have no evidence-based solution to prescribe. And what's more is that all major medical associations recommend lifestyle therapy as a first-line treatment for chronic disease. Yet today, most healthcare professionals have no effective evidence-based solution to prescribe. Redicare Control provides a solution to this lifestyle therapy challenge and large unmet medical need. Up until now, type 2 was considered a progressive chronic condition that would worsen over time and require lifelong medication. However, recent advances in precision nutritional science have shown it's now possible to reverse type 2 diabetes in as little as 16 weeks. And the technology is now available to build powerful digital therapeutics to onboard, educate, support, and monitor millions of people throughout their treatment journey. Introducing Redicare Control. Redicare Control is a clinically validated digital therapeutic for the treatment of chronic diseases such as pre- and type 2 diabetes, high blood pressure, obesity, and dyslipidemia. Our digital therapeutic can change the way we treat chronic disease. Our program brings together the evidence-based components needed to elicit long-term behavior change. The components include education, support, biometric monitoring, and this educates and empowers patients to self-manage their condition and turn their health around. Our solution is capable of scaling to treat millions of patients globally. Digital therapeutics like Redicare Control are enabling a new paradigm of care. Let's meet Charlie, and let's look at how Redicare Control changed his life, and how Charlie's story was very different to Marie's. Charlie had severe metabolic syndrome. He was multi-morbid, meaning he suffered from type 2 diabetes, stage 2 hypertension, and non-alcoholic fatty liver disease. He was on 8 medications, including insulin, GLP-1s, and hypertensives. And Charlie, for all intents and purposes, was essentially eating lots of peanuts and then taking the EpiPen to offset the reaction every day. And just like Maria, Charlie's health was getting progressively worse. Now, 16 weeks after being prescribed Redicare Control by his doctor, Charlie had lost 15 kgs. He no longer has high blood pressure, his diabetes is in remission, and he's off 8 medications including insulin and antihypertensives. And why? Well, because he was given the tools to help himself. And here's what our doctors have to say about referring Redicare Control to their patients and how it makes them feel. We've gained global recognition for our results. In fact, we were recently awarded the International Scholar Award by the American Heart Association for our results in treating chronic disease in primary care. We also recently won the UK Clinical Pharmacy Congress Award for Excellence in General Practice. And over the last 5 years, we've seen very consistent clinical results, including 48% remission rates in type 2 diabetic subjects. And remember, type 2 was previously considered a lifelong progressive condition. We also continue to see clinically significant reductions in blood pressure, triglycerides, and weight. And our clinical evidence base has been presented at 7 international medical meetings. Redicare has an experienced multidisciplinary team in place, and we have deep expertise in combining precision nutritional science, lifestyle therapy, and digital therapeutics to effectively treat chronic conditions at scale. During our product development, we've worked with 140 corporate clients. Doctors are now referring our product to their patients, and we have a rapidly growing direct-to-consumer business. There are 460 million patients like Maria who are at risk of losing their lives prematurely. And treating diabetes with insulin and medications is like treating peanut consumption with EpiPens. This needs to stop. We need to educate and support patients around lifestyle changes to treat the root cause of these preventable and reversible conditions. We can change the way we treat chronic disease globally. And if you help us bring this to life, we believe we can build an incredible business and help bend the curve on chronic disease, preventing millions of premature deaths and saving billions of dollars in healthcare costs. Sadie didn't have to lose her best friend and her mother. And Maria didn't have to die from an entirely reversible condition, leaving behind a young family. Together we can make sure little girls like Sadie don't have to grow up without a mother. Now is the time to change the way we treat chronic disease and introduce a new paradigm of true healthcare. Thank you.